I'm Christina Campbell and I'm reporting for Microbiome Times, and we're lucky enough to have here today Dr. Lindsay Hall of the Quadram Institute UK, so welcome.
Thank you.
So Dr. Hall, what do we know about the gut microbiota of preterm infants and how it's connected to their health?
So preterm infants are obviously quite different than full-term babies, and that's mostly because they're born earlier than they should be, and a preterm baby is defined as a baby that's less than 37 weeks gestation. They're obviously normally low birth weight, and they also have an underdeveloped gut and immune system. And all of those factors contribute to the fact that premature babies have an altered microbiome in comparison to their full-term counterparts. Indeed, they're normally colonised with microbes that would maybe be perceived to be pathogenic, like Klebsiella and Enterococcus, whereas full-term vaginally delivered breastfed babies are dominated with Bifidobacterium, and we just don't really see that in preterm babies.
How easy is it to modulate the gut microbiota of one of these babies?
So I think preterm babies actually represent quite a special and interesting cohort. And that's because they have a very low diversity bacterial community already in there. And actually a lot of them get a lot of antibiotics at birth, and it basically means it's a primed ecosystem, I think, ready for colonisation. So I actually think kind of either dietary or bacterial or microbiology manipulations actually have a really good chance of success in this particular cohort.
And what could that look like? Probiotics?
So I think in this case, I think actually maybe quite a select community, and that might be probiotics, so maybe a mixture of Bifidobacterium, which we know are found in breastfed, vaginally delivered full-term babies, and maybe lactobacillus as well, because even though they are what we would say is probiotic bacteria, they're actually two of the most dominant genus that we get in babies. So I think they would be an obvious kind of use in that group of individuals.
And so on the flip side, what do you know about the limits of bacterial influence on the immune system in early life?
So that's a really good question. So I still think for kind of the immune side of things, I think we're still trying to decipher what that is. The early life window is the key time for immune development. So it is so fundamentally important to make sure we have the right microbes, be that bacteria, or actually there's work coming out suggesting that the virome and the microbiome are actually potentially really important during that window. So I think we need to make sure we get the right microbes, programming the immune system in such a way that it maintains kind of that healthy balance. We don't want too many inflammatory processes, but at the same side we do want to induce immunity. But we just want to make sure that in later life that we're not seeing diseases like Crohn's disease or ulcerative colitis, which is normally as a result of chronic inflammation.
So you also studied diet, and so what do you know about how diet in early life can influence the immune system and health?
So the good thing about working with babies is the diet is actually fairly straightforward. So it's milk, okay? Particularly if it's before 6 months. So that might be either breast milk or it's formula milk. So there's plenty of studies out there suggesting that breastfeeding preferentially feeds Bifidobacterium, and that's because Bifidobacterium has kind of these enzymes that can digest specific components of breast milk. Whereas formula-fed babies, they might still have Bifidobacterium, but maybe not at such high levels, and they might have other bacteria that really like kind of free sugars, like maybe E. coli or Klebsiella. So I think the diet side of things, I think there's modulation of the bacterial populations in the baby's gut, and then they modulate the immune system. But specific components of breast milk, including human milk oligosaccharides, have actually been shown to modulate the immune system directly as well.
In terms of gut microbes affecting the mucosal immune response, what do you know about how individual members of the gut microbiota affect that response versus the whole community?
So I think this is kind of in the field, this is where we're kind of moving towards. So we've got a lot of really interesting studies looking at there's differences in microbial populations in diseased individuals versus healthy. But now we need to actually figure out what that means at a mechanistic level. And part of that might be actually, as you say, drilling down into individual species, but I think it's even more than that. We need to drill down into strains. Like some of the work that we've done is we've been looking at Bifidobacterium and modulation of the epithelium, which of course is an absolute fundamental barrier between the gut and the systemic immune system. And we found that even the same species but a different strain actually induces quite a different response in the epithelial compartment, which I think just shows you how very complex the situation is. But I think it also suggests that maybe just a one strain approach may or may not be useful depending on what you're wanting to do in the context of the immune system. Because of course that's the epithelial compartment, but what about T regulatory cells? What about innate immune cells like macrophages or dendritic cells? There might be another strain that's more important in that context. And I think as a field, that's what we need to really work towards.
Thank you so much for being with us today.
Thank you.